Aloha everybody, it's Dr. Gupta on Maui, and great question. I got a question about somebody's child that's mouth breathing, and their mother asked me, should I be concerned? I think my child is breathing through their mouth at night. And I said, yes, absolutely. It's something that you should look into. Don't get freaked out, but it's something important to look into. And why is that? What is the problem with mouth breathing? Well, have you heard of sleep apnea, CPAP machines? A lot of people who are elderly use these. Well, this starts with mouth breathing. And so when our children are breathing through their mouth, it can affect their sleep quality. It can affect things like wetting their pants at night if they're not sleeping well. It can affect ADHD. It has been associated with not sleeping well and different activities during the day being more difficult when we're not getting restful sleep because we're breathing through our mouth instead of through our nose. It can affect bad breath. So a lot of times when we're breathing through our mouth all night, what can happen is it dries out our mouth, and that causes what we call halitosis, which is bad breath. And also when our mouth is more dry, all of that bad bacteria and sugars and all of that stuff is more prone to sticking to our teeth. So it can actually increase our risk of cavities also. So we really want to breathe through our nose, not through our mouth, and help our children learn this also. How do you know? You can see drool on the pillow. If your child is drooling on the pillow, or even adult is drooling on their pillows, oftentimes it's because they're breathing with their mouth open while they're sleeping instead of closing our mouths and breathing through our nose. And the thing that I see the most that really makes me so sad is malocclusion. So when we're breathing through our mouth, it can actually change the structure of our face during development, so in our children, and it can also change how our teeth are coming together and the alignment of our teeth. And that's something to talk to your orthodontist about. And if mouth breathing is an issue, I would try to find an orthodontist who also specializes in airway, sleep apnea, things that have to do with the airway also. And what can be the cause of mouth breathing? Why are our children breathing through their mouth a lot more than through their nose? Why are we seeing this more? I don't know, but I read a great book on it called Breath, Breath. It's a bright yellow book. It's one of the best books I've read, and I learned so much from it. And what we can say, of course, it can be attributed to large tonsils, large adenoids. All of that stuff in the back of our airway can occlude that space so we can't get air in there as easily. And chronic sinusitis, allergies, things like that can disrupt that normal pattern of breathing. Also a deviated septum, this cartilage between your nose, if that's deviated and it's causing some kind of occlusion in breathing, then also our kids might start breathing through their mouth, or we might start breathing through our mouth. What I recommend, what I remember talking to some mothers in Africa about when they were talking about mouth breathing, this was many years ago when I did some work in Africa, they would actually close their baby's mouth while they were sleeping and help them learn to breathe through their nose and encourage the nasal breathing, what in yoga we call ujjayi breathing. And that helps train them on breathing through their nose instead of through their mouth. Now, if there's some kind of occlusion or airway issue, then of course we need to talk to our doctor about it. We don't want to close their mouth and have no place for oxygen to enter our body. So also, why is nasal breathing important? There's these little cilia, like filters in our nose that filters out all this gunk in the air and helps us breathe in nice, clean air. When we breathe through our mouth, we're not getting those filters and that action of the filters. So that's another reason. The other thing is moist air. That's better for our lungs. It just helps our lungs feel nice and warm and cozy when they're breathing in that oxygen. So that's where nasal breathing is important. What are my practices to do every day with myself and my child? We do breathing exercises where we do just normal breathing. And I try to slow it down. I say 5 to 10 seconds in, 5 to 10 seconds out. This doesn't only help us and encourage us to breathe through our nose, it's also good for things like anxiety and just thinking and relaxing the brain and starting the day off on a positive note. I really love that. And then I do some alternate nostril breathing. This is an ancient Indian practice that my parents did for years growing up. And so you'll just go one in nostril, pause. And then there's other breathing like just where you're doing a lot of exhaling, and then your body will automatically do the inhales. So there's different things that you can do and practice with your child to encourage that nasal breathing. I know there's a lot of surgical intervention. There's a lot of options for orthodontics and things like that, but I think there's also a space for things like, I don't know if you call it physical therapy or what you call it, but alternative treatments and approaches where we can train our body to breathe properly to help us achieve that success. What is the question? Do you have a recommendation for orthodontists on Maui? You know what? I love all of our orthodontists. I would just say my recommendation is to go and do a consultation. Many of the consultations are at no charge. You can call their offices and ask them, do they specialize in airway management also, or sleep apnea? And you can talk to them about what their specialties are, what are their interests. And oh, you're so welcome. Thank you. Thank you for commenting. That makes me so happy. It makes me feel like what I'm talking about is actually useful. But what I try to do in these videos is just answer questions that my patients, my clients, my friends ask me. So if somebody has a question about, I'm sure somebody else does also. But as far as orthodontists, I would just always recommend doing a consultation, talking to them, calling their office, see what they're interested in, where their interests are, and if they align with what you need. And then get to know the person that's going to be treating you. And then just see from there. And you're always welcome to send me a private message if you have any questions. I'm going to be doing a meet and greet with Dr. Gupta, hopefully in the next month or so. So once I get that all organized and final, I will let you guys know. But I hope you enjoyed this little chit chat on mouth breathing, and I can talk more about it and from my experience and what I've seen if anybody has more questions or wants to hear more. So I hope you have a wonderful day. Thank you for listening in, and I'll see you next time. Aloha.